Please give me a go ahead, Zipporah, if I can start.
Yes.
Good afternoon to you and to everyone. We want to welcome you to the African Region SoWN report launch. I am Dr. Maureen Musi, an early career nurse and midwife, and also a midwifery lecturer from the University of Pretoria, and also one of the Challenges Committee African Hub leads from South Africa. I'm not alone. I am with Mohammed Mutbar, from a registered nurse from Sudan, as one of the co-chairs, and also Zipporah Erengi, a registered nurse as well, one of the co-chairs from Kenya. So we are the hub leaders from Africa, and we welcome you all to our webinar, where we'll be sharing with you the launch of the SoWN report. And before I start, I want to say Happy International Day Happy International Nurses Day. We welcome you all and thank you all for attending. Before we start with our webinar, if you can just go to the chat box, introduce yourself, tell us where you are from, and what are the expectations that you have from the webinar. And then we'll go straight away to our webinar. What a day, it is to come together as nurses around, the African region, where we are here to share what are the opportunities, what are the challenges, looking at the theme entitled Migration and Retention, Empowering Africa's Nursing Workforce to Navigate Growing Challenges. So we're going to hear, from our nurse leaders from around Africa. We're also going to hear from our champions, from our nurses that are working in the front line as to, how are the contributions? What can we do, to attend or to respond to this report, to the SoWN report? And I should share with you that already the World Health Organization has started with the launch. As we are currently busy talking here, they are currently launching the SoWN report, which is the second report that we're going to be looking into. And then we're saying that we need to engage, empower, and act, so that is, mainly looking at our theme. And the report talks to us, talks to the 20.9 million nurses around the world. We see the hard work that you are doing. And then, so let us hear, we're going to be hearing from our nurse leaders as to how can we contribute to this report. And it's good to say that we also have ICN, which also launched the IND report, and we'll be sharing that with you, the useful links from the chat box. However, this report doesn't only tell us about the challenges, but most important, the opportunities that we can look or forge into, moving forward into carrying on the report. And I should say, I also had attended the launch from the World Health Organization, and it was good to also hear or to be able to also see one of the CNOs, from South Africa, Dr. Makanya, also sharing, with others, what are the things that can be done from around, especially looking at when we are here, we are focusing at the African region. So what is it that we're going to look at in terms of the African region? So I'm not alone. We're going to be hearing, from our experts, we're going to be hearing from our leaders as to what is this report saying. So just to go through the agenda, we're going to be hearing the summary key findings for Afro region from Professor Champion Nyoni. He will be sharing a 10 minutes information with us to summarize what are the key findings that are coming from that State of Nursing Report 2025. We're also going to hear from our nurse leaders that are here with me today in the panelists. We have Professor Mavis Mulaudzi from South Africa. We have Dr. Consolata Kirigia, the Dean of School of Nursing from Kenya. We have Moafaq Hassan, the President of Sudanese Nursing Organization from Sudan. We also have Dr. Samuel Matula, the director from the World Health Organization Collaborating Center of Nursing and Midwifery from Botswana. So we really have extensive panelists here with us, going to share with you how is it that we can contribute. Again, I repeat, the theme will be migration and retention, empowering Africa's nursing workforce to navigate the growing challenges. So we'll be starting with the report, the SoWN report 2025, summary key findings for Afro region from Professor Nyoni. Professor Nyoni is a lead for education and training, health workforce unit from the World Health Organization Regional Office, Africa. Over to you. What is the report saying to us as nurses and midwives in the African region? Thank you so much. Over to you.
Merci beaucoup. Can you see my screen? Please confirm if you can see my screen. Oh, I see a thumbs up. Okay, great.
Yes, see your screen.
You can see my screen, you can hear me. All right, let me just one technical thing and then I'll be good to go. Right. Okay, good afternoon, everybody, and thank you very much for having me, and happy International Nurses Day to all you nurses out there. Your hard work and what you do for our continent and our African region is really well noted. And I am sitting here in Brazzaville, Congo. That's why I tried to greet you with a bit of French to say bonjour à tous and merci beaucoup. That's the few French that I can remember, but thank you so much for inviting me. As mentioned, I lead health workforce education and training, and with the aspects of nursing issues coming in. And my role here is just to have a chat for the next 10 minutes about the State of the World Nursing Report. And what you then make out of the State of the World Nursing Report becomes a bigger part of the conversation with the nurse leaders and the thought leaders that are part of the team. So often, what I want us to perhaps zoom in about is starting from the start. What is the State of the World Nursing Report? Because we often throw around these words and then we're attending a seminar about this, but we still wonder what were they really talking about? And then from there, what were the methods that were used to generate the data that's in the State of the World Nursing Report? And then I want to zoom in on the 3 or 4 key areas or these thematic areas around this report, issues around jobs and employment for nursing, issues on education, service delivery, leadership, and then tied up to what is the report recommending in terms of policy directions through 2030. And the reason why 2030 is put as a tag, I'm sure you all remember the Sustainable Development Goals, and the idea is that by 2030, we should be looking back and saying, hey world, where are we? This is what we wanted to do. Have we arrived? Again, a tiny technical issue. My mouse keeps on running away. And I have found it. Good. So when we talk about the State of the World Nursing Report, its initial version of the report was presented in 2020, and that was during the time of COVID, and it was initiated by that idea of the 2020 being declared the year of the nurse and the midwife, and the conversation was around what is the state of nursing globally. So this report is a comprehensive, up-to-date analysis of the nursing workforce globally. So it features issues around key indicators of areas in nursing, issues on education, education capacity, advanced practice nursing, and even issues of remuneration. So the point is to gather all the data around nursing and issues related to nursing. We put it together in this one comprehensive report and say, hey world, this is the state of nursing. What are we going to do about it? So the way that it's developed, it's often through what is called the National Health Workforce Accounts Process and Platform. So this is the primary method in which the State of the World Nursing Report is brought. And the National Health Workforce Accounts are country-level official statistics that report the health workforce state within a country. And so the National Health Workforce Accounts, they use globally standardized classifications and definitions of occupations, and they define these occupational groups. I think for nursing, they've got two main categories, the nursing professionals and then the associate nurses. And these are then used to then enumerate the numbers, the quantities, and issues around nursing or around that particular professional group in the country. And this is defined by your International Standard Classification Occupations of 2008. And it's an annual report that is sent from country level, usually sent to the WHO, and WHO works around collating this data. And there's a platform, it's called the NHWA platform. If you can Google it, it gives you accurate or latest official data at country level, at region level, on the number of nurses in your country, where are they working, how are they distributed, what's the gender distribution, and so forth. So check out National Health Workforce Accounts as a data portal. It can also be quite good to update yourself and know exactly, even when you're writing your research papers and whatever you get to be involved in, that you are referencing up-to-date data, not only on nursing, but on the general health workforce. So in each country, there is a National Health Workforce focal point, or a person who is designated. Usually they're a senior authoritative official in the Ministry of Health, and they're designated to collect this data and relay this information and statistics to the World Health Organization. So this gives the credibility and makes this the only source of data as official that is coming from the state or from the member state, feeding into the entire report. So the data that comes in, or this is what official does, they shade according to these National Health Workforce norms and standards, and then this is then captured into what we're going to talk about as the report. For this report, I wanted you to note that the reporting period was between February 2024 and November 2024. And this was the data for 2023, meaning that if we're coming now to 2025, from February to November 2025, it will then be depicting the data of 2024 in that particular fashion. So as you are seeing this data, which is showcasing what's happening, also have it in mind that this is data that was in 2023, and this is what we are presenting as the state of the world nursing. Now, when the report was launched today, I think it was way early in the morning, countries as far as Japan and so forth started celebrating the report. It is available on the WHO platforms, and I think the Nursing Now team will also share this report with everybody. I really encourage you to get a moment to go through its entirety, because what I'm going to talk about here is just African-specific data, but it's important to look at where we are from the African perspective against the other regions of the world, and whether we've made significant progress or not. So looking at the aspect of jobs, employment, the jobs and employment for nurses is growing, but it's not fast enough. So currently in the African region, I want to make sure that my statistics are correct. There are currently 1.7 million nurses in the African region, of which 77% of these 1.7 are classified as the professional nurses, meaning that the rest of the number, which is 28%, fit in the category of associate professional nurses, which are often engaged to do basic nursing services, cleaning. In some cases, they call them nurse aides, nursing assistants, and so forth. They make up the 23%, while of the 1.7 million nurses in the African region, 77 are nurses. And nurses in the African region constitute 68% of all health professionals, which is already talking to you that this is sort of a nurse-led type of health system, because there is a bulk in terms of the nurses, and these nurses are delivering these pivotal health services that come in. We still have a very low density, and I think this picture that you're seeing here reflects a challenge in terms of the density. The more redder the color, the lower the density of the nurse against a population. The darker or the bluer the color, the more higher the density of the nurses against the population. And in Africa, we're talking of an average density of about 8.7 nurses, which is the lowest in the world when you compare it to the other region, followed by Southeast Asia, followed by the Eastern Mediterranean region. But there has been a steady increase, and this is what the report is showing, a steady increase in the density of nurses in the African region, and this has been driven by the strategic investment in health workforce development that's been happening across our region. And the nursing workforce is relatively young. 43% of the nurses in the African region are less than the age of 35. While on the other end, and I just wanted to pause here purely because of the role and function of the Nursing Now process, that you are working with the largest batch of nurses because they are less than 35%, and that's 43% of the nursing workforce. But then on the other end, 15% of the nursing workforce are above the age of 55. So this is signaling an upcoming retirement in the next decade. And we need to think strategically, how are we going at least to cover this 15% of the nurses that will be retiring in the next 15 years? Will our production match this 15%, or will it surpass, or will it not be? And Africa has the highest proportion of male nurses globally when compared to all the other regions. 34% of the nurses in our region are male. And this is a notable shift in gender representation, where nursing is often perceived as a predominantly female profession. However, the projection is that by 2030, the total number of nurses in our region is projected to grow up to 2.1 million. And this projection is purely based on the current levels of productions. And we're saying with the current approaches of intervention, we're looking at our continent growing number of nurses to about 2.1 million. So this is what the jobs and employment section looks like. Specifically for education, I just gleaned the following aspects to look at what's happening with education. And again, just to make sure that my statistics are correct, 67.1% of all the graduates from all nursing programs within the African regions are female, and 32 countries have reported that they have national and even subnational accreditation systems and mechanisms for health workforce education and training institutions. And this accreditation is layered in some countries, where the accreditation is for the institution, and there's also sub-accreditation for the programs. And in some of the countries, they even talk of nursing having dual accreditation, where accreditation is in higher education space and also accreditation from the professional bodies, which is really looking at strengthening their quality assurance in nursing education. And there was an investigation on the length or duration of pre-service programs. Majority of the programs in our region, 63% of these pre-service programs are 3 years in duration. We still have a significant number that is 4-year program, and a smaller number that is 5-year nursing programs, and also a number that has got a 2-year nursing programs leading to a professional qualification, which we are still, I think that would be an area of discussion and debate about, will we ever move to a space of standardization or a space of saying there is some sort of harmonization across the region. When it comes to service delivery, 21 countries in the region have a designated authority for nursing regulation that provides oversight and accountability. This could be your nursing council, your nursing body that is specifically focused on nursing. And 18 countries require nurses to pass a licensure examination before entering practice. And when we're talking about 18 countries, the Afro region has got 47 countries. So we still have a bulk of countries where licensure is not practiced, and students immediately are engaged into the system. 27 countries have systems for CPD, and again, look at it from 47, 47. We still have 20 countries that do not have CPD mechanisms for nurses that ensures lifelong learning in that space. 29 countries have formal advanced practice nursing roles that is looking specifically at expanding the nurses' clinical autonomy and scope. And this is really strengthening the idea of provision of health services in a decentralized approach, and while these services are still of high quality. 65% of countries have now specific regulations regarding working hours and employment conditions for nurses, and 95% of those countries that reported have implemented a minimum wage regulations. 7 countries have offer mental health and well-being support packages for nursing at national and subnational levels. Something that I found quite interesting, and I think it's something that you could look at as you're engaging with the report, was the issues related to the median wage for the nurses. And in our region, of the 47 countries that in the region, only 27 countries reported on this, and they reported that the median nurse wage is at 480 US dollars per month, not months, but per month, which is the median wage in which nurses are paid in this particular region. And there is a better and deeper explanation in the report in terms of not just the wage, but looking at the wage in the context in which the nurse is working and the buying power of that particular currency and what it can purchase within the space, because these are essential drivers for migration, these are essential drivers for retention, these are essential drivers for influence in terms of quality service. When we look at the leadership in nursing, 2 key findings that are specific to the African region is that 19 countries have established the position of the government chief nursing officer, the CNO. They come in various names, but within the function of this is the top nurse who's working within the government and speaking on behalf of nursing. And these are key to elevate the voices of nursing in national health policy. And then 43% of countries have reported having nurse leadership development programs, which is really focused at country level, investing in future nurse leaders who can drive system-wide change and transformation. So these are the 4 key areas that you'd find in the report that speak from a global level and also zoom in to specific issues in the region, which is what I tried to glean in for this particular presentation. But the major way forward that is being proposed by the report is around, number 1, the issue of health workforce planning, that the planning of the health workforce should be informed by labor market, that there should be labor market planning and labor market forecasting to guide nursing workforce strategies, that we don't just wake up and suddenly we're increasing intakes of nurses, suddenly we're doing this. There should be an alignment from the intakes to the graduation, to the employment and the retention and retirement, that it should be between or informed by labor market, that we should create adequate and equitable employment opportunities, particularly in primary healthcare and underserved spaces. We look at strengthening recruitment and retention policies to deploy nurses where they are most needed, and to uphold the global code of practice, the WHO global code of practice for ethical and sustainable international recruitment. Also looking at education and training to align the nursing national education levels with defined roles in health and health system. And I think this came quite strongly around the conversation of diploma-trained nurses, bachelor-trained nurses. Do we see a difference? How should the difference look like? And how do we recalibrate the nursing education levels in such a way that there is clear definition of roles within health and education system, the scaling up of domestic training capacity to meet national health system needs, implementation of competence-based curricula that reflects quality standards, learning innovations and population health priorities, and also an investment in faculty development to ensure that educators have strong pedagogical and clinical expertise. In addition, when it comes to the next slide is talking to service and delivery, and the 2 key issues that were being highlighted was how do we strengthen the regulatory frameworks and make sure that these frameworks support the development of nursing councils and nursing boards, and ensure workplace policies promote safe well-being and retention of nursing. In specific to leadership and governance, and I added a few things from the strategic priorities, was that we need to establish and empower senior nursing leadership roles within the ministries for governance and influence, and also expand leadership development opportunities for nurses at all levels, and also consider the development and integration of the advanced practice nurses role, think more closely about addressing gender inequalities in some spaces, and particularly focusing on pay equity and working conditions, leveraging digital technologies to support education, regulation, and service delivery, and then thinking more closely to the role and involvement of nurses in climate and the sustainability agenda. So to wrap up this presentation, what does the future look like? Two main things that came out from the report. The progress is there, but it's insufficient. The number of nurses is projected to grow by 30% to 2.1 million in 2030. And there will be an estimated shortage of nurses in Africa of about 1.8 million in 2030, contributing to the 6.1 million gap of health cadres in the African region. So the report presents a large sum of statistics, a large sum of numbers, a large sum of issues that are in our faces. And I think the big question is, how do we take this forward, not only in understanding the report, but how does it influence our day-to-day activities and practice that we improve the quality of nursing? Thank you very much for having me, and I hope this is clear, and I would love to direct you to the report for further discussions on this. Thanks, and over to you, team.
Wow. Thank you so much, Professor Champion Nyoni, for sharing with us, the report, from the State of the Nursing Report. I really do think that as Africa, we have so much that we have to think about, looking at the challenges and also looking at what could be the opportunities, that we can look at in terms of the report. So I'm not sure if we're going to be having time for questions, but I think the colleagues are going to put in the questions on the chat. But we also want to hear now that we have heard the report. I just think about one of the things that you spoke about, which is the shortage of nurses in Africa, 1.8 million. I think that is, such a huge number that we need to be thinking about, 1.8 million shortage of nurses. And if we look at this, one of the challenges, or one of the things that we must consider, is that many of our nurses are migrating. Many of our nurses from Africa are migrating to high-income countries, which is posing a critical challenge to the sustainability of our healthcare system across the continent. While migration does offer individual opportunities for remuneration or professional development, but this leads to a significant workforce shortage and in already a strained healthcare system. So let us hear from our nurse leaders, across the African region. What does these findings, say to us? How can these findings drive the change? So let us hear from the nurse leaders. What is it that they think that these findings, we can do with these findings? I think we'll start with Professor Mavis Mulaudzi. She's the South African Research Chair and a professor of nursing at the University of Pretoria, representing the South African region. So just to share with us, Prof, what do you think these findings are saying to us? What are the challenges and what are the opportunities that we can look into as a region? Thank you.
Thank you very much, Dr. Musie. And thank you so much, Champion, for summarizing the report the way you did. I really think this report poses a lot of challenges to us, more especially looking at the fact that we are not left with more than 5 years for us to reach the Sustainable Development Goals. So when you look at the issue of a shortage of nurses, and we're talking about 1.8 million, I think that is really very critical for us, more especially us who are in the training institution, because the other thing that was raised was the issue of intake and retention, trying to balance the two. Because in certain instances, you will find that we are training a large number of nurses, but when we train them, they don't have opportunities. We don't retain them because we do not have positions for them. I'll give you an example of South Africa, where we train a large number of nurses, but we do not have a distribution capacity. We do not align the intake and the retention. So in the end, the people that we are training have to migrate to other countries for better opportunities. And I think that is something that we need to have policies, conducive policies that will retain our students that we're training in our own country. And that must be coupled with conducive policies for practice so that we can have conducive practicing environment, because people don't live because of not having a job only, but also the issue of poor working condition drive them outside. We also have to look at issues of seamless education in Africa so that we can have migration, but then our people must not migrate outside Africa. If we could retain them also in a continent, I think for me that will be something that is really very important. I also feel that the issue of migration need also issues of international cooperation. If the developing countries are taking nurses from us, there must also be incentives that are given to our own countries so that we can be able to train more. We need those policies so that we can try to ensure that this migration is done, but it's done in a way that it is formal and orderly, in a way that other countries must not suffer. We also have to look at issues of empowering our workforce in a way that they will feel the need to stay in their own countries. Issues of further education, making sure that our nurses specializes, and also ensuring that we also leverage on the issues of digital technology that is currently being introduced. What are we going to do in Africa to ensure that the nursing challenges that we used to have becomes less? I just visited UK just now, and I saw that they even have equipments that allows them to turn patients without nurses being strained the way we used to do. And they have AI equipments that they're using for that. How do we try to do that in Africa? And how do we support each other as a region to ensure that our training is improved, and to also ensure that there is issues of ensuring that the working environment is also conducive. The issue of social support, let us support our nurses. Today is Nurses Day, and I listened to how the nurses are struggling in their own environment. In rural areas, we are even having issues of gender-based violence that are also affecting nurses who are working in rural areas. Now they move from rural areas to urban areas, and the distribution capacity in countries will differ because the majority will be in urban areas and the rural areas will remain without enough staffing. And I really think that though with those few issues, I really feel that the issue of education is very important so that we can train and make sure that those that we train are retained in our countries. Yes, we can have people going to other countries, but let us make sure that when that is done, there is also something that our countries are gaining. I really think that we need to look more into this report and see how we as Africa can again have enough engagement with it and see how we can plan for the future, because the issue of the shortage that is being shown here is scary. And the aging workforce like myself is also a challenge because the majority of us are leaving soon. Thank you so much. I think I will end here and give other colleagues a chance. Thank you.
Thank you. Yeah. Thank you so much, Professor Mavis Mulauzi. I think you really made us to think about a lot of things, a lot of ways, a lot of possible areas that we can look into. But I like one of the things that you talked about was looking at the seamless way in which we can retain our nurses in our continent. So we really need to look at, how we can retain this migration so that it stays within our continent. I think thank you so much for that. I think the questions are coming. We'll be able to take upon different questions at the end of the session. But we really thank you so much, Professor Mavis Mulauzi, for sharing with us from a South African from South Africa to say, what is it that we are saying in terms of the key findings that we found in terms of, the shortage of nurses and also, the aging workforce. We really appreciate you for that. Let us also hear from one of our other nurse leaders, Dr. Consolata Kerigia, the Dean of School of Nursing from the University of Embu in Kenya, to say, what are these findings saying to us? How can we drive change, to look at ways that we can look at the migration and retention, empowering Africa's nursing workforce in these challenges? What is your say, Dr. Consolata? Over to you.
Okay, thank you. And may I wish all the nurses a wonderful Nurses Day today. Dr. Consolata from University of Embu has just been introduced. From the report, we see that nurses still lead in the workforce composition, which has raised to 68% from 58%. That was indicated in the 2020 report. This means we are still the biggest or the largest cadre in the composition of health workforce. Then there is also a point on shortage of nurses. I agree because I work in a university where we have a shortage of advanced trained nurses. Seeing that we have so many nurses forming the biggest composition in the health workforce, and then when we come to universities where we need advanced, highly educated nurses, we are not able to get. So this means that this translates to nurses doing undergraduate and not advancing their knowledge. The reasons most probably, according to me, is maybe because they are migrating, therefore they have no time to advance their education. So what is the takeaway from this? We need to rethink on how we support nurses as far as advanced education is concerned, because we know by caring for nurses strengthens economies. Once a nurse finishes bachelor's, we need to encourage them to register for advanced education and maybe support them as a country or as institutions. We can encourage them maybe by paying for them or even motivating those who have decided to pay for themselves. This way, we will not be having shortage of PhD doctors, because these are the people teaching universities. Currently, we advertise, we re-advertise, we don't get because they are not there. So I call the nurses, I call leaders, and I call even the government to invest in advanced nursing education. This one will support nurses and the nursing workforce at large. And this one, of course, once they advance their knowledge, they will not only work in universities, they will also give specialized care to patients in hospitals. And this one will reduce poor health outcomes in those healthy facilities. With those few remarks, I wish to stop there and give my next presenter a chance also to comment on the report. Thank you.
Thank you so much, Dr. Consolata, for, raising an issue that we also need to look at in terms of education as well, making sure that we engage in CPD, continuous professional development, lifelong learning, and making sure that we have those advanced education. I really do think there's a lot that we can work on as a continent. So yeah, definitely we're going to be looking into those. Thank you so much for sharing with us in terms of the report. Let us also hear from Moafak Hassan, the president of the Sudanese Nurses Organization. 5 minutes, if you can share with us, what is it that we can use, from these findings to drive change? Thank you so much. Over to you.
Thank you very much. Happy International Nurses Day for all of us. I'm Muwafaq Hassan Hashim Ahmed, founder and president of Sudanese Nurses Organizations, and also one of Global Nursing Leadership Institute Scholar 2024. In this day, we need to appreciate what is done in Africa. Actually, it is appreciated. There is increase in nursing stock, 70% increase. It is okay to have this percent, but we need to work to increase this percent. In Eastern Mediterranean regions, the only increase is 3%. What we need to do by what we have in this finding, this is the challenging thing. So we need to work more on policy that attract nurses and retain them. We need to more also to work on initiate more initiative about the leadership, importance of the leadership, and how we can get benefit from CNO positions. I appreciate the effort done by Nursing Now Challenge in terms of leadership, and also by the ICN in terms of leadership also, as they have the Global Nursing Leadership Institute, one of the big initiatives that's supporting leadership. We need to have something like this in Africa, which will activate more our CNO roles. We need also to invest in pre-service and post-service training. There is experience actually done previously in Botswana and other countries, South Africa. It was about training of nurses post diploma in children care, and which will have more impact nurses in children care. This initiative also have been done in Japan and also have increased the service delivery. This is initiative that we need to activate and need to do. Also, we need to bring in our mind, we are always struggle as nursing. In 2020, supposed to be the year of nursing and midwifery, but unfortunately, COVID came and we stopped and in our area. So we still in 2020. We need to act more, to achieve more. The other thing we need to take in our mind, there is only 5 years to achieve the SDGs, 2023, and also universal health coverage, which will be done by the contribution of nurses. We need to activate the role of nurses in primary health care, and this will be achieved by motivate nursing, retain them in Africa, and also pre and post service. Not just this, also we need to create job for them. If you train nurses without job opportunities, if you have a high motivations and no job opportunities, if they have high qualifications with no job opportunities, this is what we need to work for. This is also actually, we are talking about 1.8 million nurses we need to have. This is will let me think about the challenge that we are facing. The conflict, the migrations, the educations, also quality of educations, accreditations of universities of education itself. Um, Now, because Sudan is in conflict and there is also some other areas was affected in the conflict, the pipeline was affected of health workforce. We need to have initiatives that support this. Support the continuity nursing students to continue their educations so that the pipeline for nursing health workforce will not be affected by some of this by this circumstance, including conflict, including natural disaster. One thing that I also want to take in concern, we have to work in the 5 priority policies that we need to focus on. And this including the weeks or the salary of the nurses, which is will be motivated and also will be attended. Not just the salary, also other contributing factors, including the work environment, work distributions, and also let them make policy, be part of the decisions making. And I think this second report is a translation of what I am highlighting now. We have Dr. Emilia Lato at WHO. We have Dr. Pamela Cibriano
Thank
at
you. I
the
think we're
at
looking at
ICN.
time.
Yes, and we have
Yeah.
a lot of leaders. So the floor for you, Maureen, and I am happy to join this and looking forward to work with
The
you.
Q&A, yes. Okay, thank you so much, Moafak. I think you talked to us the importance of, having chief nursing officers, in the different places. And also, if we think about it, we are 5 years left to go to attaining the SDG goals. Are we ready? Are we within the range, to meet, the SDG goals? This is also some of the things that are coming from the conversations. Thank you so much for that. Let us move to our last nurse leader. Then we'll go to our frontline nurses. Let's go to Dr. Samuel Matule, who is the director from the World Health Organization Collaborating Center for Nursing and Midwifery Development, University of Botswana. Over to you, Dr. Samuel.
Thank you. For this opportunity. And I would also like to thank WHO and the Nursing Now initiative for having been able to collect this data and put it together so that we can see the inequities that we are seeing at this point. And I would say Happy Nurses Day, nurses. And so I think most of the items that I was going to address, some of people have touched on them, but I'll just expand on those. So migration, it is something that if we look at this report and the previous report, it is something that we have to be systemic about it. It is an issue that we are not going to be able to stop. We're looking at the global shortage of nurses as well as the aging in terms of nurses elsewhere. And then also looking at the work environment and also the resources that are in place in terms of those areas that attracts our nurses, leading to brain drain in our healthcare systems. So these gaps are clearly evident in our healthcare systems, and I think as a continent, we need to be strategic or even pragmatic about this whole issue. And I think I would like to agree with Prof. Mlaudzi. She was, it seems like we're thinking at the same level of thinking. Because if we can't stop migration, that one is given looking at the current situation. But we can turn the migration issue into an opportunity for us as Africa. Reason why I'm saying we can turn it as an opportunity, we can intentionally make policies that do not stop migration, but rather benefit the countries that are actual origins or originate, where migrants originate from. For example, if I was to give an example, is to say we can agree with the countries that actually are looking for healthcare workforce, because we do have healthcare workforce, we do have nurses, and we have a lot of students who want to be nurses, but because of the resources that we have in place, we can't admit all those students in place. So we can make an intention to train for export, and then at a wage that we agree, or that the money that we get from those programs goes straight towards nursing welfare, or towards improving nursing welfare in the our own countries, rather than channeling the money elsewhere. Rather, we take the money and improve the welfare, because we are looking at the median welfare for $480. So I think that can be, if that can be improved, if we improve our welfare and also improve the working conditions of nurses, and then we will have those who wish to migrate, and then we will also have those who want to train to be for migration, be trained to migrate, and we'll be benefiting from those migration aspect. And another aspect that I want to emphasize is the remittance from the nurses that migrate. It can also come a long way in terms of addressing some of the iniquities that we get to see. And then we should also leverage on those who migrate, the skills, the innovations that they actually work with. Let's try to see how we can get them back home and be able to address our working environment and improve the working environment for our nurses locally, and then also to improve the outcomes for our populations. And as you have asked right now, that the question on whether are we getting closer to our developmental goals, sustainable development goals, we are still far as countries. And the strategies or the work, what we had before, what we have put in place, seems to not be working. We spend a lot of money. I'll give example with my own country. We spend more than 15% of our GDP towards healthcare services, but the health outcomes don't seem to be showing that, because maybe we are not using the money appropriately. Maybe we are using the evidence, or we are using the technology that is not working towards solving our own problems. So maybe we can get those who worked in those environments that actually have solved some of this problem come back home and solve some of those problems for us. So I'm looking at these because we do have a potential. We have the youngest in terms of population of nurses right now. And when we look at the global is on the other end, is what towards aging. So definitely when the population ages, they're going to come for our younger nurses. And that's why we need to be pragmatic about this whole migration and retention, and try to empower our healthcare systems through this very same problem that we are facing, turning our problem into an opportunity. Thank you.
Thank you so much. I think we are almost out of time. With our frontline nurses, if I can just give you 2 minutes each, if you can share with us how we can work with the findings. I will start with Joy Abelo, an early career nurse from Nigeria. 2 minutes to just share with us your thoughts on this. Joy? Okay, let's move to Fatima Salih, a community nurse and founder and CEO of the Sudanese Nursing Leadership Initiative in Sudan.
Hello everyone. I'm audible?
Yes, go ahead.
Yeah, thank you so much. Happy International Nurses Day to all nurses around the world, especially those working in the most difficult, fragile, and under-discovered setting. I want to express first my deep gratitude to the Nursing Now Challenge for advocating for us, pushing us forward, and connecting us to platforms that turn our passion and mission into impactful realities. Special thanks to Professor Aisha Halawi and the entire Nursing Now Challenge team for their invisible and visible effort in supporting nurses around the globe. I also want to congratulate everyone on the release of the State of the World Nursing Report 2025. This is not only a proud moment, it's a call to action for all of us. I want to share with you quickly my personal story. When I chose nursing, my family had a clear vision for me: study, graduate, and leave Sudan to work abroad. It was considered the most logical and beneficial path. And this sentiment wasn't unique to my family. It was the same for many of my peers. But I found myself asking, why should leaving be the only option? Why cannot we stay and create change in our communities? Why cannot we find a purpose, dignity, and opportunity here in my country? This internal question shaped my journey. I began by supporting my peers at university, showing them that nurses are powerful, valuable, and central to change. I launched a platform to amplify our voices, and today it has reached over 18,000 nurses across Sudan. I saw how many of us are connected to Sudan, ready to help, but targeted by a system that failed to support or protect us. The situation in Sudan now is extremely difficult. Our healthcare system is overwhelmed under discord and fragile crisis. COVID-19 exposed that crackles our educational infrastructure. Then we have political instability, revolution, and finally we have war. Now it's became the third year. The consequence, nurses living in a mess, students unable to graduate, new graduates are paralyzed by fear and lack of experience. I have witnessed these realities firsthand. I had stood beside students who feel lost. I have seen promising nurses leave not because they want, but because they have no any other options. They want to survive. This is why the State of the World Nursing Report 2025 is so important for all of us, especially for my country, Sudan. It gives us data, insight, and advocacy power to demand change. We need urgent policy to retain our nurses, empower them, protect them, and offer them a future worth staying for. Migration should be a choice, not a forced escape. And we must build a system in our countries that offers safety, support, fair pay, leadership opportunity, and recognition. I deeply believe in the power of nurses to lead this change. And I believe in our collective ability together through a platform like the Nursing Now Challenge to act. Let us not wait. Let us this moment to push, to use this moment to push forward, stronger than ever, for our nurses, for our communities, and for the future of the healthcare in Africa. Thank you so much for this opportunity. Over to you.
Thank you so much, Fatima, for all the work that you are doing in Sudan, making sure that, so we really do appreciate you and thank you for the work that you are doing. Can we just get closing remarks and calls for action? I think we just left with 5 minutes from
Hello.
Dr. Fabi Kiyokhadze, the Chief Nursing Officer, Ministry of Health from Botswana.
Maureen, but before that, we have Joy, please. We have Joy before the closing remark.
Oh, okay. I was told we are left with 5 minutes. Okay.
Okay, I'll just make this. Hello. Okay, can you all hear me?
Hello, Joy. 1
Yes.
minute, 2 minutes. Then we'll go
Okay.
to the closing remarks. Yes, thank you. Joy, we cannot hear you. Okay. Yeah, I really think we have a lot that we still have to, talk about. Professor Nyoni, I think you can agree with me that we need more of these sessions where we can talk and look at our challenges and ways that we can, mitigate these challenges. I really do think that going forward, let's have more and more of these webinars. Let's go to Dr. Hwabi Kiyokhadze, the Chief Nursing Officer, Ministry of Health, Botswana, for the closing remarks. Thank you so much.
Okay, thank you. Thank you very much.
Dr. Hwabi?
Musi,
Yes, yes,
are we
and we can hear you, but we can't see you. Okay.
Yeah, my camera is not showing here. I don't know what's wrong, but I have my video on.
Okay, no problem. We can go to the closing remarks and close
Okay,
call for action.
Thank you very much. But I wanted you to see the team that is with me here. But unfortunately, I have a full room of nurses whom I've invited to come and listen to this very important message today. I want to thank Professor Nyoni for the summary of the State of the World Nursing Report. We'll still find time to go through the report. At least we are fortunate enough to have seen the previous report. I hope the current report also will give the insights as the previous one. I also want to thank all the presenters for the insightful messages that they shared with us from training institutions, from Ministry of Health leadership, and even from young nurses. I will just make a short summary and I will share my typed summary later. I was just jotting down as the presenters were talking. And I've picked that most of the talk really came from education, job creation, and leadership. Concerning education, one of the speakers highlighted that it is very important to balance the training and absorption of nurses, because it is evidence that some nurses complete and they are not absorbed in the system. This leads to the migration, because if people are trained and they are not employed, they end up going somewhere to look for jobs. We have seen that employment is increasing, though very slowly. It is indeed very slowly, because we still have in countries where people complete and they are not employed. And yet we are crying of shortages of nurses. You know, we shouldn't be talking of nurses shortages when we have nurses who are not employed. So I think really we need to work on very serious policies that talk to employment of nurses after completion. Somebody mentioned that we still have nurses at diploma level, very few at degree level. We need advanced nurses. We need nurses who have specialized, so that when they perform their duties, they are at a specialized level. We talk of conducive environments. One of the presenters also mentioned that in some places, nurses refuse to go to rural areas. They prefer urban areas. This is mainly because of the infrastructures in rural areas, because of, you know, when you are there in the rural areas, there's just a lot that you miss out. And this leads to the imbalances of staffing, where you will have more nurses in urban areas and very few in rural areas where we really need them the most. We all know that, you know, in rural areas, we need to give a lot of education. And if we have less nurses there, then it means we really have a lot to work on. We need empowered nurses. We need